And here we go. Welcome everybody. This is Dr. Jeffrey Hanna here at Clear Chiropractic, and I've got a video here for you today about concussion, whiplash, but also people who might be wondering, why do I have more pain and discomfort at the end of the day when I get tired? It's all about brain function. And I'm going to unpack a little bit of something that I found in a research article just today here that I wanted to share pretty much right away. I'm going to try to make this as non-technical as possible because it's really easy to start getting involved with all the neurology here. But in a nutshell, what it is that your brain is what controls the position of the different joints in your body. However, as you become more fatigued, the brain is not able to maintain as strong of control. And as a consequence, it's more likely that we may experience injury to that area. And if you have a pre-existing neck injury of any kind, whiplash, concussion, even if you're not experiencing any symptoms, it means it's going to be altering the function of your brain. Your brain will not have the normal capacity, the normal resources to maintain control, which in turn creates a positive feedback loop, which is one of the reasons it can be so tricky for people recovering from concussion, recovering from whiplash, to ultimately heal and to stabilize, and why things are so up and why things are so down. So let's jump into this and have a little bit more deeper look. Okay, very quick first. What I want to showcase here is that your neck has a huge amount of ligaments that provide normal control and stability for all of the bits and pieces in your neck. Now, the muscles of your neck, they are sending to your brain at any given time huge amounts of sensory information, what's known as proprioception. It's the sense about where the head and the neck is in space. Your brain receives that information and then is able to make the appropriate adaptation. We need to be a little bit tighter on this side. We need to have a little bit more control on this side. And if there's ever an area that has been injured in the past, we need to keep a closer eye on that. So there is this positive feedback system that exists between the neck and up to the brain. The brain is ultimately going to control and regulate things as much as possible. However, as I'm going to show you, that if you've ever had a neck injury, that there's not going to be as much stability here and your brain has to work harder. However, if your brain has hit the point of fatigue, it's not going to be able to maintain control quite as good, and it's going to be more likely that people then are going to experience neck pain. They're going to be more likely to experience headaches. They're more likely going to experience dizziness, vertigo, and also potentially brain fog. Reason for that is because the structure, the function, the stability of your neck has a profound impact on circulation within the brain at both a microscopic level and also a macroscopic level. So let's have a look at some research here. All right, the effect of exercise-induced central fatigue on cervical spine joint position error, strength, and endurance. So what the researchers had a look at: fatigue is common in sports, impairing performance and increasing injury risk. Yet little is known regarding fatigue and concussion. Impaired neck neuromuscular function may contribute to concussion at baseline, while central fatigue may further impair neck function, resulting in increased concussion risk. Let me back that up just a little bit. What they're saying here first is that the regulation and control of the neck has a profound impact on the way that your brain is going to work. In fact, there was a study that I'd come across this probably about 2 years ago. I'm pretty sure it's on this channel. What they found is that a lot of people who experience a concussion, it wasn't actually their very first neck injury. People all the time injure their neck, slips, falls, minor fender benders, even 5 miles an hour. They think absolutely nothing of it. But if they've damaged any of the muscles, any of the ligaments of their neck, what it does is it sets the stage. It primes the body, it primes the brain toward a neuroinflammatory state. What it means then is there's the possibility that if you have that second impact, even if it's not quite as severe, it's more likely to jar the brain. And if you jar the brain, then you're going to start to experience more issues down in the neck, which in turn is going to create this. And again, that's the start of the positive feedback loop right there. It's a phenomenon that's known as second hit syndrome. And it's one of the reasons why we know that if a person has had a whiplash, a neck injury, a concussion at one point, they are more likely to experience recurrent episodes, even if the injury is not as severe after that. Now, the researchers go on to say, even if a person necessarily hasn't had a concussion, maybe if a person is absolutely fatigued, they've been perhaps doing exercise for a long period of time, which is what the researchers looked at here, but can also have broader implications in our day-to-day living if we are working extended hours, if we are stressed to the max, if we are not sleeping well, if we're getting our head or our neck in a wrong position when we're sleeping. That's going to fatigue the brain. And if the brain is fatigued, it's more likely that we can actually experience a neck issue as a consequence. So they're having a look at this two-way street here. So let's scroll down there. So the purpose of this study was to determine the effect of exercise-induced central fatigue on a neck joint position error, strength and endurance in healthy subjects and also those with a history of concussion. So they had 19 healthy people and they had 5 people with a previous history of concussion. Now, there was a significant increase in constant and absolute joint position error, decrease in neck flexor endurance, and decreased neck strength in neck flexion in healthy subjects following fatigue. Now, in this particular case, the way that they had measured a joint position error, it's a very, very simple test that's done with a little laser on the head. And what you do is you have a person believe that they have their head in a normal position, and then you start to move it in a few directions, and you try to bring it back into the normal position. Whatever the brain, remember, based on that sensory information from your neck going up to your brain, believes is normal and neutral. What they found, though, that is if you had a person do a whole bunch of exercise, that even if they didn't have an injury, that they would start off shooting. In other words, where they thought they were bringing their head and neck back to neutral was going to be off a little bit. And we'll show you in just a little bit a few other ways that you can actually assess for evidence of joint position errors and, more importantly, what you need to do to help them. So point being here is that they find that even a person doesn't have an injury to their neck per se, the altered sensory information going to the brain from a fatigued neck is going to fatigue the brain, and they're hypothesizing, because we already know this, if a person has poor joint position sense, they are more likely to experience an injury in that state. And again, even if you are not doing contact sports, this means that if you fatigue your neck in the day-to-day activities, sitting in front of a computer, looking at a phone, doing a lot of activity where your head is sticking forward like this, or maybe you are an electrician looking up, twisting your head, a mechanic, but all kinds of angles, that cumulative fatigue sets you up for injury, which is going to affect your brain, which again can set you up for injury. Now, among the concussion history subjects, all of them also demonstrated significant increase in absolute constant joint position errors for a significant decrease in neck flexor endurance, 1 in neck flexion, and then the other 3 in extension and rotation. In other words, it was kind of all over the shop. All of them showed that there were issues, but that there were more issues in certain positions. Now, the researchers didn't get into this, but we might hypothesize that these particular weaknesses may have corresponded with the nature of the injury. Think of an example of a whiplash in a car accident. There's a big difference between if you get hit from behind and your head goes like this versus if you get hit from the side. Or if you get, and you're playing sports, you get tackled front on, or you get tackled from behind, or you slip on the ice and you fall head first, or you fall backward, damaging different kinds of structures in the neck. So their conclusion, Cervical neuromuscular function deteriorated following fatigue in healthy subjects. Resulting impairments may affect force alterations in cervical control. Here's the important part: potentially increasing concussion risk. And people with concussion history descriptively demonstrated similar results. And then they add, as most research papers do, more research is necessary in this particular area. So again, a lot of big words in that. But in a nutshell, what it means is if you've got a neck injury of any kind, any description, it has the potential to affect your brain. And if the brain is fatigued, whether you are healthy or whether you are not, it means that things are more likely to go wrong here in the future, even if you haven't had a new kind of an injury. This is super important concept for people to understand whether or not you have whiplash, whether or not you have concussion. If you are working with somebody such as a chiropractor, such as a manual therapist, a massage therapist, a physical therapist, an occupational therapist, the question often arises, why is my correction, why doesn't my treatment last forever? Why do I always seem to go out of alignment at the very end of the day or early in the morning, different things like that? Brain fatigue might be one of those contributing factors. It is that when you have so much activity, so much stress, and your brain is no longer able to maintain the normal control of this, it's more likely that things are actually going to go awry, causing you to go out of alignment, causing the muscle to seize up, causing the joint to lock into the wrong position. The potential idea, or the idea and the implication here, it goes on and on and on. In other words, these kinds of things, they set us up for relapse. And this is the number one thing that we find in our particular area of practice, is the number one thing that's going to cause a person to go out of alignment is stress. In other words, stress because the brain is fatigued or is having a sudden spike or surge of something that it just is not able to maintain control anymore. Boom, the switch goes because it's not able to maintain the control here, and that's oftentimes where we need to make an additional correction. I would love to be able to say to any person, yep, all we ever have to do is one simple, fix, and everything's going to be solved forever and ever, amen. Well, we live on a planet with time, gravity, and stress. I don't know how to cure those things. And as long as we have a certain degree of stress that's going to fatigue our body, that's going to fatigue the brain, there's that propensity toward relapse. Of course, as our body heals, it should take more and more stress, meaning you're able to get functional improvements that stabilize for longer and longer periods. If a person has to keep going back to see their chiropractor, their physical therapist every 2 weeks or something like that for years and years on end, either A, person's really doing something wrong with their life, B, they have horrific amounts of damage and things are just simply put not stable at all, or 3, the practitioner could very well be missing something. Now, that's not me diagnosing or calling anybody out, but the body is designed to heal itself. We have to respect limitations of time matter because, again, we live on a planet with time, gravity, and stress. Same breath, things should be capable of stabilizing over a long period of time. Now, in this particular study, as we said, the researchers were looking at joint position error by measuring functional neurological feedback in terms of how the brain was able to communicate with the neck. But I want to show you one of the other ways that you can assess for joint position errors that are actually going to be customized for the individual. In other words, there's not just a problem that's affecting your brain and your nerve function, but where is it and what's necessary to correct it? Let's have a look at that. What I have for you here, these are a couple examples of what are called cone beam CT slices. This is an upright diagnostic scan that shows the health of the bones, the health of the joints. It shows you normal anatomy, and it also allows us to see what is happening at the individual levels of your neck when your head is in a neutral position. Any joint in your body, I don't care if it's in your neck, your low back, your little toe. in a neutral position. It should be neutrally articulated, sitting with the two surfaces right across from each other. So you might be able to see this little black space. Okay, so these would be the two edges of the bone right there. And again, this is designed to move. And as we see right here, beautiful. The two edges are sitting exactly where they are supposed to be. Same thing on this example right here. Maybe there's a tiny disrelationship right there, and even very tiny things, your brain is very much aware of them and is going to do whatever it takes in order to maintain that normal control. But let's cross over to this side right here. You can see the edge of this does not line up with the edge of this. This is the top vertebra in the neck between basically the base of the skull and then the C1 or the atlas. This is arguably the most important joint of the body because A, it provides the most amount of sensory position to the brain about where the head is in open space, but also has the most profound implications on circulation, arteries, veins, cerebrospinal fluid, and also pressure dynamics that occur within the brain. In other words, that ain't right, and that has a profound impact in terms of the function, not just of the muscles, not just of the ligaments, but of the spinal cord of the brain itself. That should not be there. Here we have now a slightly different example. This is what's known as a digital articular X-ray, where what we are seeing here, this would be where the top vertebra in your neck is sitting. Here's the C2, the C3, and so forth. And this is taken from a very specific kind of angle. It's different in everybody because we all have different anatomy, genetics, etc., where we're able to actually assess the joint spaces between each of the individual vertebrae in the neck. And I would like to bring your attention to this little guy right here, even if you're not uber familiar with this. I hope that you can see that little black space right through there, and that you can see the white trim of this part of the bone here, and then the white trim of this part of the bone here. And I think that what you would agree with me, what you see is that you see that top one has come backward. Let me actually turn my hands around so that it's going in the same direction here. It's come backward. This little guy has gone like this. This is evidence of a joint position error. If this person has their head in a neutral position, that should not be sitting that way. And what you can see, the area above it, just fine. The area below it, just fine. But that little guy, in this particular case, the C3, and that's the C3 joint on the left side, oftentimes going to make a nasty little knot right in that spot. Like, oh, something feels like it's right there. And the muscle's going to be tight, and the ligaments are going to be tight. And what I'll also point out, when a person has this particular kind of a misalignment in their neck, this can start to disrupt circulation that goes up to the brain. And a person can start to feel vertigo. They can start to feel dizzy. They can also feel a sense of anxiety, because if the brain is not receiving the normal amount of blood supply, even if it was only 5% less than it should be, that compounded over days, weeks, months, or even years can start to have a profound negative influence on our brain-to-body functions. Now, oftentimes people will say, you know what, I've already had all kinds of x-rays. I've already had all kinds of CT scans, MRIs, ultrasounds, the list goes on and on and on. And everybody says, my results are normal. Well, if that is the case, vast majority of times that these kinds of images are taken, they're looking for overt signs of pathology. Broken bones, dislocations, tumors, bleeding, infections, stuff like that. And in the absence of that, they say, nope, everything just looks fine from that perspective. But just because something may not be overt pathology doesn't mean that the system is functioning the way that it is supposed to. So far more important that any diagnostic tests that you have, ideally you are marrying up the results of that test, looking not just for the pathology, but also for signs where that is not exactly healthy, versus with your other symptomatic presentations. Do you have a headache? Do you have dizziness? Do you have tight muscles? Do you have a concussion? All of these different kinds of things. And then what we try to do is we try to put these together to say, what is the most logical explanation for for what's going on. And as a consequence, what do we need to do in order to help you out? Start feeling better, restore your function, and get your quality of life back. Now, as I said, especially where whiplash and concussion are concerned, as much as I'd like it to be a quick and easy fix, there is so much that goes into it because it's a brain and spine issue, let alone any number of other factors that might be stressing your life out, have reduced your capacity. In other words, it's a long road. But what it requires then, and what we know and what the research is showing us, is that it's necessary to have the appropriate time to heal. It's necessary that you stack the deck in your favor, doing everything that you possibly can to do well, to allow your body to heal. But it also means that you have to look at the structure, the function of your neck to make sure that that is working the way that it is supposed to. So if you want to find out some more information on that, what I recommend you do, visit us at clearchirospokane.com. We've got links to all other kinds of articles, videos that talk about the health of your neck, how it affects the rest of brain to body function, and a little bit about the specialized type of care that we do that can actually help you out. So I hope you've enjoyed this video. Again, a little bit more of a mouthful than I've been trying to do of late. We're going old school, I suppose, here today. But if you have enjoyed it, please do, number one, hit that like, subscribe button. Number two, share this with friends, family, clients, colleagues, people you think would benefit from understanding what's going on. Most importantly, what can be done to restore their health. And then lastly, again, if you want more information, visit us at clearchirospokane.com, or if you're in the Eastern Washington, Northern Idaho area, or anywhere else in the country or the world for that matter, and you'd like to have a consultation with us, you can reach out to us, 509-315-8166. We'd be happy to help you out, do the best we can, point you in the right direction. Thanks again for watching. This is Dr. Jeffrey Hanna here at Clear Chiropractic. Get well, live well, stay well. Till next time, take care. Bye-bye.